यूट्यूब का।
तो यूट्यूब वाला कहाँ मिलेगा भाई? इसने भेजा नहीं मुझे।
मैं भी सर वही चेक कर रहा हूँ अभी शायद। हाय, गुड इवनिंग।
हाँ जी, गुड इवनिंग एवरीवन। आई थिंक वी आर लाइव नाउ।
यस सर, वी आर लाइव। गुड इवनिंग।
तो
Are we audible? So, I welcome Dr. Tewari sir for this meeting, and this is the surgery recall for today's exam, and uh, this is FMG January 2024 exam. So, I welcome you all, and I welcome sir to this meeting. So, now we can see the chat box in front of us. So, let's start recalling the questions. Okay, we are not here to discuss any question. Okay, we'll be not discussing. We just want to know that what are the topics and what are the questions you remember. And if you remember the question properly, and if you can tell us some options, it would be good. And we'll try to find out the questions and options from some other sources also. And then there will be a session on which we will discuss the questions when we get all the questions and the options correctly. Then we'll discuss that. That will be a different session. Okay, so Arun, Shweta, yes, Shweta is saying 4 years gangrene. So 4 years gangrene was one
was it an
question.
image based question? Because normally they ask an image based question on Fournier. Was it an image based question, Shweta?
Shweta, was that a image-based question or just triage priority? Yes. Crepitus gas. So this was like gas gangrene or crepitus gas or somewhere else crepitus gas. Image, 4 years gangrene, image was there. Yes, very good. Triage priority is fine. Crepitus gas, was that a gas gangrene question? Pneumothorax was the question. Pneumothorax, Arun, very nice. Other questions? Shweta, Rahul, Arun, Shadab. Okay, anything else you remember? These are like 4 questions I have written on 4 years, triage, crepitus.
Shweta, can you elaborate this crepitus question? Most likely it's a gas gangrene question where they emphasize on debridement.
Yes, gas gangrene, crepitus, Arun has said, sir. Diaphragmatic hernia symptoms. Okay, congenital diaphragmatic hernia. Okay, amputation of foot and the swollen limb after amputated. So, Shadab, is this the question of gas gangrene in which after amputation patient has got gas gangrene, or this is some other question you are saying about the amputation? Is this the same question about gas gangrene, or these are two different questions? Omphalocele image, yes, nice.
Okay,
Okay,
let's
but
narrow down. Any question from breast? Breast, then
okay,
thyroid. Any question
that
from
would be
breast?
better. Thyroid and breast, any question? Hypothermia में mild moderate, that is actually a medicine question, hypothermia per se. Air fluid level in left hemithorax. Okay, CDH, that is about congenital diaphragmatic hernia. Okay, lymphangiosarcoma, Stewart-Trevis syndrome. Erwin, this is what you are saying. Lymphangiosarcoma, that Stewart-Trevis syndrome. Fibroadenoma, about the benign tumor. Shweta. Gastroschisis management. So omphalocele and gastroschisis both were there, or only omphalocele or gastroschisis, whatever. Both question was thyroid was asked. Abhishek, if you remember what question in thyroid, hollow viscous injury, perforation, peritonitis. About this, the X-ray was given. Blast, blast injury, the organ injured. Okay, okay, both gastroschisis and omphalocele were there. Good. Blast organ damage, tympanic membrane. I'm sure if you have marked correctly. Omphalocele image, yes. Hollow viscous injury is about that gas under diaphragm, or some other question about hollow viscous injury. Okay, gastroschisis first step. Okay, fine. Covering the bowel and all. Okay, fine. What else? In the thyroid, what was the question? Somebody said that there was question from thyroid. Graft rejection. Okay, what was the question on graft rejection? Most organ. I mean, in which type of transplant graft rejection is most? Is this is what was the question, Shweta? Tympanic was not in the option, then maybe a lung or small intestine, whatever was in the option should be the answer.
Any organ containing air gets injured first. Air
80
containing
years,
organ.
12 centimeter central incision. So this is about incisional hernia. Okay, Arvind. Central incision hernia treatment means incisional hernia treatment. Kidney was the answer of what?
No, most common graft rejection. Can you tell the options? Small intestine was the option there.
If small intestine was in the option, then that should be the answer. Road traffic accident, abdomen, history was given, hollow viscous injury. Okay.
Lung was the option in blast injury, then lung must be the answer. If tympanic membrane is not
Lung
there,
should
the
be.
first tympanic membrane, then lung, then bowel.
Highest graft rejection actually occurs in small intestine. Highest graft rejection as well as highest graft versus host disease, small intestine. Seatbelt injury, about seatbelt injury, they ask mesenteric tumor, mesenteric injury. Yes, small intestine, if it was there, then that should be the answer for the maximum chances of rejection. Breast cut on one side and swelling around axilla area. So the Sanjay and Ann, is that a image-based question in which they have shown some breast and with axillary lymph node involvement? Hollow viscous injury, previous history of myomectomy, myomectomy,
Mastectomy. It must be mastectomy.
mastectomy.
10 years
And
ago.
okay, and now she presented with axillary swelling. Okay, so this was a question about the recurrence of the this breast cancer because after mastectomy, swelling, what was asked, and seat belt sign was given, and which organ damage. Okay, so usually in seat belt, this mesentery, duodenum, pancreas, vertebra, these are the organs that can get damaged in seat belt. Benign mass in parotid treatment, superficial parotidectomy. 10 years after breast conservation, swelling in the upper limb, lymphosarcoma. Yes, post breast conservation, when there is radiation is given, increase the chances of lymphosarcoma. Yes.
Let's
Superficial
elaborate. Let's
should be the
elaborate
answer.
one by one. Can someone tell me the seatbelt question? What was the complete question? What were the options? Seatbelt, what was the option? What was the question? Which organ is injured most common?
Option was hollow visceral organ.
Hollow viscous is common. After mesentery, second is hollow viscous. So if mesentery is not an option in seatbelt, then hollow viscous is the answer.
Manwan syndrome tumors was asked. Okay. Lungs are not damaged in seatbelt injury, if you are asking that. Okay, so what are the options in seatbelt injury? If mesentery and small intestine was not given, then what was given in that seatbelt injury? Spleen was there, liver was there, two options.
Spleen and liver usually is not injured. Mesentery, small intestine, retrobronchial organ. Duodenum,
If,
hematomas,
if
pancreas, vessel
pancreas was
thrombus.
there, then pancreas would be the better answer. Between liver, spleen, pancreas, pancreas should be the better answer, sir. Rajiv Tewari, sir, that should be the, I mean, if
Yes.
mesentery was not there.
So the options were liver, kidney, spleen, pancreas. I presume these were the four options. Pancreas is the best answer
Yes.
out of these four. There can be disruption at the neck between head and body. That is the best option. If intestine was not there, hollow viscous was there, it is similar. Hollow viscous was the option, then that is the answer. Hollow viscous is the answer.
Hollow viscous includes the whole GITs from stomach to the large intestine. Everything is hollow viscous. So hollow viscous would be the better answer because that duodenum can get injured between that seat belt and between the vertebra and the seat belt. Okay, so duodenal injury can occur.
Complication of ERCP. Shadab, was it most common or just they asked complications?
Or there was complications of ERCP are all except because if pancreatitis, cholangitis, duodenal perforation, all these three would be the complication. Okay, so was it a most common complication or all of the following are complications except? Initial treatment of gastroschisis is you put the intestine back. If it is going, it is fine. Otherwise, if it is not going, you cover the intestine and gradually you put it back inside. Okay, if there is crepitus, then gas gangrene should be the answer, Ria.
So ERCP, it was most common complication. I guess that was the question.
See, duodenal perforation and cholangitis, I guess pancreatitis would be the better answer if the
Yes,
most
first is
common was.
pancreatitis followed by cholangitis.
Yes,
These are the two
pancreatitis should
most
be the
common.
answer. Hmm. Pancreatitis should.
Pancreatitis and cholangitis. These are the two indicating order. Then duodenal injury. Reiter
Yes.
syndrome.
Reiter syndrome is not surgery. Reiter syndrome is maybe related to eye or something, uveitis and all. I mean, if it is
It is
Reiter's.
in urology actually, urethritis, conjunctivitis. So urethritis, chlamydia, urethritis, and conjunctivitis and arthritis. That's Reiter syndrome. HLA-B27. It was omphalocele, not gastro. By Roni, people are saying dono the, both are there.
Cause of acute liver failure. Acute liver failure in Western countries, the most common cause is drugs, and in our country or in this part of the world developing, the viral hepatitis is the most common cause. Okay, SDH CT image was there.
Reader syndrome HLA tha, then it should be B27. Highest transplant reduction, intestine, kidney, lung, heart. Intestine is the answer.
Intestine is the answer. If intestine was there, intestine should be the answer.
SDH पे क्या question था? What was the question on SDH?
On SDS, there was some image. So CT image was there, Shadab. Yes, highest failure rate or highest rejection, intestine should be the answer.
Intestine is the answer. You see, intestine has lots of lymph node. So immunologically, it is most active, and it has the highest rate of rejection as well as graft versus host disease. CT image
Okay.
subdural. So I think it
Image
is
of
easy.
CT.
Hernia classification PL2.
Okay, that was European Hernia Society classification.
Huh.
Fine. PL is primary, indirect, and the effect should be between 1.5 to 3 centimeter. Simple CT image, fine. How many, I mean, what do you think? How many questions of surgery were there? Like between 35 to 40 or less or more? Pain on walking, that is stage. So this staging was asked, that is that Rutherford classification or Fontaine classification.
नहीं
Okay,
वो नहीं पूछेंगे, नहीं वो नहीं पूछेंगे इनसे. They'll not ask classification. Simple question होगा, claudication का simple question होगा. What was the question
pain
on
on
pain on
walking,
walking?
intermittent claudication.
Yeah, primary lateral Roni, you are right. It's indirect.
Yes.
CT subdural, I think it is an easy question. Hernia classification was asked less than 30. What is less than 30?
Less than 30 questions they are saying, sir. That
Acha,
is.
less than 30 questions.
I mean,
okay, but still, I think questions were quite easy. Questions straightforward ही थे जो आप लोग बता रहे हो. They are straightforward question. Nothing complex, nothing complicated.
so stage 1, 2, 3, 4, sir. Probably this was the Fontaine classification they had asked.
Acha, then it's Fontaine
Stage 2.
classification.
Yes, stage 2. Stage 1 is asymptomatic, 2 is intermittent claudication, 3 rest pain, and 4 gangrene.
So, if 12 centimeter incision hernia is there, answer will be laparoscopic mesh repair.
Structures preserved in modified radical neck dissection. Okay, this was the question, Shadab. MRND. The question was on MRND. Okay, MRND, which is preserved except.
Boyd classification पूछा था इन्होंने. Pain on walking 1, 2, 3.
Somebody was saying that there was no. I mean, it was not written that what is the name of classification. In Boyd classification, there is only 1, 2, and 3. There is no fourth thing in Boyd classification. And it is only for the intermittent claudication. But if they had given only that pain on walking, and that should be, I think that if the name was not given, that should be a Fontaine classification. Yes, submandibular gland we don't remove in MRND, if that was the answer.
What was the option? Options were nerve. Which nerve? Which nerve was there? Cerebromastoid is fine, interjugular vein is fine. Which nerve?
See, if it was written Boyd classification and patient had stopped after walking, then it should be Boyd 3. Okay, in Boyd 1, the patient is having patient can continue to walk. In 2, the patient is having pain, but still the patient is able to walk. In 3, patient has to take rest. So if Boyd was written and the patient was stopped after walking for a while, then it should be Boyd classification 3.
Common carotid artery was the option, then that is not removed.
If common carotid in, modified radical neck dissection or radical neck dissection, what was the exact question? Common carotid artery is not removed in any neck dissection, basically.
Submandibular is optional actually, which is why I wanted to know the all options. Submandibular we don't remove, but it can be removed if involved or if required. Spinal nerve we remove. Sternocleidomastoid mastoid we remove, interventricular vein we remove. These three structure we remove. But you can preserve one of them. Common carotid not an option, then subintibular gland is the option. Then that's the answer.
Yes.
Then subintibular gland is the answer. डॉक्टर गौरव क्वेश्चन तो इनके आपके सारे पढ़ाए हुए थे. व्हाट अबाउट जीआईटी? जीआईटी से क्या क्वेश्चन थे? क्वेश्चंस फ्रॉम जीआईटी.
जीआईटी एंड hernia पे तो there was
and urology. GIT and urology. GIT question, can you tell me? Gallbladder, liver, pancreas. Milas submandibular is the answer of that question.
Yes. In urology, what were the questions, if you remember? Urology, anything from kidney stone or RCC or some congenital kidney disorder. Ecclesia cardia is the most.
What was the question? Ecclesia, what was the question in ecclesia?
Was the barium image was given or it was just a question? Acute pancreatitis. Okay, manometry का question था. Manometry का question on the investigation of choice for this ecclesia cardia or something else. Okay, acute pancreatitis, there was given some history of pain radiating to the back with history of alcohol intake. So if they were asking what is the diagnosis, then acute pancreatitis is correct.
This question has been asked many times in FMGE.
CT image was given to identify structures like liver, pancreas,
pancreas. Okay.
Was there a pointer or a arrow which was showing this? Okay, stricture of bulbar urethra, esophageal cancer treatment, investigation of choice, esophageal cancer, endoscopy and biopsy should be the ecclesia. There was image. Squamoadenome line comes up in Barrett's esophagus area. History of halitosis. History of halitosis can be seen in Zenker's as well as in ecclesia. So we need more information to say what was actually.
Esophageal cancer, IUC is endoscopy.
Yes, if endoscopy was alone in the option, endoscopy. Progressive dysphagia, initially to solid foods and weight loss investigation. Yes, endoscopy.
This is cancer. This is cancer. Go for endoscopy. Mesentery
of esophagus makes diaphragm. Okay, if that diaphragm was in the option. Dorsal mesentery of esophagus contributes in the formation of diaphragm. Sliding type of hiatus hernia. Yes, endoscopy is good enough. Okay, blast injury में कौन सा organ? Whatever organ there is air. Okay, so the most common is middle ear. If that was not in the option, next comes in the line is lung. If that is also not in the option, then intestine. Okay, middle ear, lung, intestine. These are the organs which are affected. अच्छा, G junction moves up. वो G junction moves up का ना sliding hiatus hernia पूछ रहा है ये सवाल. अच्छा, sliding hiatus hernia. G junction columnar line is moving upward. हाँ नहीं G junction moves up. That's sliding hiatus hernia. That's correct. Okay. Okay, it is G junction, no. So it should be sliding hernia. Endoscopic shows sphincter is upside. Which sphincter upside?
G junction has gone up. What I think, what you mean is G junction gone up.
G junction gone up.
So yes. That is sliding hiatus hernia. And what is gold standard for achalasia? Manometry. PET CT
isotope 18 fluorodeoxyglucose, if that was in the option. Fluorodeoxyglucose.
ये कह रहे हैं डॉर्सल मेसेंट्री में दो ऑप्शन थे, pleuroperitoneal membrane and crust of diaphragm. What are the other two options? Most common complication of ERCP, pancreatitis.
Pancreatitis.
If G junction has not moved up, only squamous junction is written, then answer should be reflux and Barrett's.
Okay, urology, only that bulbar urethra question, nothing else, nothing from the testes, nothing from the kidney stones or tumors.
No, only that question we've already discussed. Patient having dysphagia for solid progressive and weight loss. That is cancer. For that, answer is endoscopy. That's correct. But probably there's another question. नहीं एक्चुअली प्रॉब्लम क्या हो रही है ना कि आप जो ऑप्शन लिख रहे हो उससे आंसर चेंज हो जाएगा. Barrett's
If
is not an
Barrett's was
option.
not in the option, then in the question also there should be G junction which is moving upward, and that should be type 1 sliding hernia. If that options are of hiatus hernia.
Ovarian torsion investigation of choice. USG Doppler. ये तो गायनी का क्वेश्चन हो गया.
Ovarian torsion is gynae.
Urology से any other question? What about thyroid?
Ovarian torsion is gynae question, Abhijit. Any question from shock? Any question from sutures or blades or any other image based? Okay, there
What
was
was the
one question.
question on TPN?
Corneous gangrene, yes, that we have written. Corneous gangrene was fine. Fluid of choice in severe pancreatitis. If they are asking IV fluid of choice, ringus lactate should be the answer. Men1 cancer, which is associated and not. Shock, what was the question? KD Georgian, what was the question in shock? Neurogenic shock was given, bradycardia, something.
Yeah, it is saying BP and low heart rate, bradycardia.
Low BP, low heart rate. Yes, neurogenic shock is
Neurogenic
correct.
shock.
I'm sure you have marked it correctly. Neurogenic, yes, fine. Gallbladder is removed. उसके बाद बोले history best is diagnostic. After gallbladder removal it was in the question, it was written histopathology shows some cancer or something. Sanjay? Tonsillectomy 2 weeks ago is again goes in ENT. 2-3 days after attack of acute pancreatitis, we prefer TPN or antral. In case of mild pancreatitis, and suppose it is not written, antral is always preferred over TPN.
If
Okay,
he
until
can
unless
tolerate orally, there's no vomiting, no
uh,
pain after feed, he should take enteral. Enteral is
if the
always better than parenteral.
if patient can take antral, antral is preferred.
Men when cancer wala tha parathyroid. Parathyroid
Okay.
cancer, normally we don't get in men when we get parathyroid adenoma and hyperplasia. But what was the
Pistos,
question? Complete question?
Pistos surgery, there was question, image-based question about chronic pancreatitis surgery, Pistos.
Abhijit, answer of shock is neurogenic.
Pancreatitis, yes, we don't give 5% dextrose as resuscitative fluid in pancreatitis, so that should be the answer. Okay, 5% dextrose if was there, that should be the answer, which we don't give. Okay, you have to choose the wrong statement, that should be the wrong statement.
So cholecystectomy, Gaurav, was actually DVT. Question
Yes,
is,
there was
cholecystectomy led.
leg pain and swelling. So investigation, yes, duplex, venous duplex scan or
Yeah,
Doppler.
that is a
That was
DVT.
DVT, yes.
That is not cholecystectomy, that is post-operative. After any surgery, major surgery, you can have DVT.
What was the question? Okay, cardiac tamponade related to the JVP. Okay, fine. Cardiac tamponade, there is increase in this, JVP, or you can say the venous pressure increases. Distended neck veins are seen. Yes. Most common tumor of appendix in the appendix was the carcinoid in the option.
No, you're saying pseudomyxoma peritoni. Mucinous adenocarcinoma. If pseudomyxoma peritoni is there, then it's rupture of
Okay,
mucinous
most common
adenocarcinoma.
tumor of appendix which is causing pseudomyxoma peritoni is yes, mucinous adenoma. Which mode of feeding done after Pistos surgery? Mode of feeding should be enteral feeding only. Okay, we don't need to give TPN after Pistos surgery if that was the option. Which of the following is seen in men 1? If there is parathyroid adenoma, then it is correct. Parathyroid adenoma is one of the tumor in men 1 syndrome.
Mohammad Adib probably his intestine was not an option, but hollow viscous is option.
Okay,
Hollow
now
viscous is
absent
option.
Y descent. This is a medicine question. Okay, that XY and that is the wave. That is medicine question, Shweta. X descent, Y descent, and whatever that is medicine.
Was this a question absent Y descent? Because this was the option of one of my GT question this month only. In January, I kept a question of cardiac tamponade with absent Y descent.
This is that what they are saying. In cardiac tamponade, there was one of the option absent Y descent.
Very
Yes,
good.
X present and Y absent. So if they were asking what is the answer, what is the diagnosis, then yes, cardiac tamponade should be the diagnosis. Yes, mucinous cyst adenoma is the most common reason for
Yes, that is the answer.
peritoni in males.
Lymphangitis answer, Shadab. Thumb prick.
Thorn prick injury and in thumb and radiates till axilla. Yes, lymphangitis.
Lymphangitis.
Furuncle is very localized kind of infections.
Refeeding
Yes,
syndrome, except what was the option?
refeeding syndrome, hypophosphatemia, hypokalemia, hypomagnesemia. These three things are seen. So whatever is the fourth thing, that should be the answer. What was the question on triage, Ananda?
Acha, hyperkalemia was the option. That is not seen. Hypokalemia is seen.
Yes. What was the question on triage? Basal cell carcinoma picture was given and they asked about the management.
Margin. They ask about margin.
Adhesion on the margin. Or
Hyperkalemia नहीं होता refeeding
from
में. Hypokalemia.
hypokalemia is seen, not hyper.
Hyper is the answer.
Yes, hyper should be the answer.
अच्छा, color coding थी triage की red.
Okay, red is the top priority. High priority immediate transfer. Yes, red should be the answer. I mean, the highest priority is given to the red. Okay, so I can see there are like I think there were like more than 30 questions. Image-based question of the ulcer rolled beaded edges. So that was the basal cell carcinoma. Okay, beaded edges, rolled up edges. Rolled out edges. Okay, punched out is seen in arterial ulcer. Okay, so for basal cell, rolled out edges. Okay, what was the question on fibroadenoma of breast, Nanda? Freely mobile lump, something like that. Young patient, freely mobile lump, or popcorn calcification, something like. I mean, these words were there in that fibroadenoma question. Histopathology. Surest sign of abdominal dehiscence is a serosanguinous discharge from the wound. Serosanguinous discharge from the wound.
Serosanguinous discharge called salmon pink sign, normally seen between 5 and 7 days.
Yeah. Varicose vein was what was the question on varicose? Mobile mass in the breast, freely mobile mass. Yes, it should be fibroadenoma. Young patient, freely mobile.
Rubbery.
Sanguinous is correct. Yes, firm, rubbery, mobile in the breast should be fibroadenoma.
Mouse, pre-mouse.
Farmer with squamous cell carcinoma.
Rubbery appearance, moving mass. Okay, ठीक है. So
X-ray of pneumothorax is fine.
ये सारे वही क्वेश्चन है, इसमें कुछ खास नहीं है. So Dr. Gaurav, anything you want to say here?
So I think that the question, I mean, all the questions I can see were not anything like out of the blue. So most of the questions, I'm sure I can like looking at the options and looking at the chat and the response of students also, I can, I'm sure that they must have marked at least like 80 to 90% correct in these surgery questions. This is what I believe. I mean, this is like a straightforward question paper, and most of the options and the questions were very straightforward. History of DVT, then breathlessness should be pulmonary thromboembolism.
Investigation पूछा है. They have asked investigation. Female bedridden patient 3 days out for state में leg pain, that is DVT.
DVT. Scan should be Doppler or duplex scan.
Doppler. Duplex, yeah.
Okay, so now we want to ask you that how do you like, how will you say, or how will you say that the surgery part was there? Did you find it very difficult, or it was okay, or it was like better than the other subjects? OBG and PSM was hard. I mean, maybe, and but how was the surgery? Okay, surgery was better answerable. Yes, Abhijit. And as far as I can see, there will be 35 or 40 questions. Let's we'll compile the questions and the options, and then we'll come again and we'll discuss the questions. We'll discuss the options also, and we'll discuss the most probable answer. Okay, because all these things are memory based, so at times you also don't remember. I mean, 300 questions. It's not possible that you can remember the question and the options properly. But yes, based on the memories of lots of students, we'll find out and we'll make a question paper, and then we'll come back to you. Okay, yes, a little twisted, little bit here and there in the language they do. Better than other subjects. क्या लिखा है याद नहीं आ रहा? Don't worry, Ria. You will get very good marks. Okay, so this is the common feeling after the exam. You don't remember, and many times you don't want to remember also. I mean, you are coming to this recall session. That itself is showing a big confidence. Otherwise, if you are like scared about the exam, you would have not come to this recall session, because then people, they try to just wait till the result, and so. Breast cancer staging not given. No problem. Okay, breast cancer staging, CAP classification are very frequently asked question. So it's not like that every time they ask the same question. CML leukemia is medicine question. Okay, so. Okay, so thank you very much for your inputs, and thank you very much, sir, Rajiv Tewari, sir, for
Thank you,
joining
Gaurav. Thank you,
this
students.
session.
चलो
And
भाई आराम से सो, now relax now. Enjoy
yes,
tonight. Relax करो, picture देखो, सो आराम करो. चलो, all
we'll
the best to all of you. Good night.
all the best. We'll compile the questions and we'll come back with the solution. Okay, so thank you very much. God bless you all, and all the very best. I'm sure all of you will pass with very nice and great marks. Okay, thank you.